we are ready to get started. Thank you all for being here. We appreciate your attendance. And myself and Claire, our social worker, are here. And we're going to talk a little bit about coping with stress, anxiety, and depression. So we've had a personal experience of a little bit of that as we're trying to log on here. So we're going to try and do some breathing and relax a little bit. So this is, I think, one of the most important things in terms of a skill set, because we know that dealing with something that is, let's say, persistent and is without any real, let's say, end date, or that we don't have a sense of when all of this stress around the pandemic is going to come to an end. And so that heightens the impact of it on us. And we know for sure that our patients are going to be experiencing many, many different kinds of reactions. And of course, it's very individual, depending on your health situation, depending on your living situation, how near or far your family may be. So all of us, I think, are going to be experiencing stress, anxiety, and depression. And so what we're trying to do in today's session is kind of talk a little bit about what we mean by these terms, and then begin to give you some ideas about how to best manage the stress that comes along with dealing with the pandemic as we're going through it. So that's our plan. This is us, so Claire and myself, and we're here at Rumsey Center at Toronto Rehab, and we will be presenting the talk. There's 2 or 3 things we want for all of you to take away from this experience. We first of all want to give you some idea of the spectrum of emotional responses that we all have, and that emotional responses themselves are very normal. That is how our bodies and our brains recognize that we're dealing with something that needs to be monitored and needs to be addressed in some way. So we'll talk a little bit about what kinds of emotional responses we may notice. And also what we want to get across is that because this stress that we're undergoing is persistent and it's going to last for some while, that it becomes very, very important for each of us to find something that we can actively do that helps us to buffer against chronic stress. So if we have stress today and then we figure out what we need to do to manage it later today, and we take time to manage that stress, usually we get over that challenge and we move on. The problem comes in when stresses kind of pile up or they accumulate one after the other. And that's when it becomes most important to be finding ways of managing stress and intervening and doing those things on a regular basis. And one of the things we want to highlight today is breathing, and how to use breathing exercises in a way that actually helps us modulate stress, or to bring our stress system down to a level that we can manage in a more appropriate way. So these are the goals that we have for the session. And just to review the ground rules, that what we're going to discuss are for educational purposes, and certainly it does not replace information that you need to reach out to your own healthcare provider for, and that we certainly recommend that all of you also do that, in addition to the good work that you're doing in informing yourself about the kinds of things that may be helpful to you. We'll do our best to answer as many questions as we can. If we don't get to your question at the end, then we will try and get some answers and post them on the website. That's the Cardiac College website. You can ask questions throughout this presentation. If you look at the bottom of your screen, there's a little button that says Q&A. So if you click on that, you can type in a question at any point during the presentation, and we will try and get to those answers before we finish up today. So if you don't see the little button there, you may need to move your mouse around a little bit so that that pop-up screen emerges and you can find the Q&A button, and then submit your.
Okay, so I think last time Dr. Reitav was here, he focused on the elements of a good new normal routine and the importance of trying to wake up at a regular time each day and taking some time to greet the day. So taking 30 minutes to 60 minutes when you first get up to sort of do something that is important to you, that fills you up with good energy to help you get through your day. So for example, sitting in the sunshine and reflecting on what you intend to accomplish during the day. Starting the day with an affirmation, like I believe that something wonderful will happen to me today. Planning an exercise break, maybe 2 energizing breaks, and time to connect with family and friends. And then at the end of the day, writing down 3 things that you're grateful for in your day.
Absolutely. So hopefully some of you tried some of that, and it may have been helpful. So we want to build on that. We want to talk about some additional issues that are important to understand, and we're going to go through some definitions.
Yeah, so the first definition is stress. And so stress is the normal mobilization response of your body to perceived danger. Anxiety is the mobilization reaction from anticipation of danger, situations based on past experiences of danger. And depression is when a shutdown response occurs in your body. So when danger is inescapable.
So what you can see is that each of these is kind of on a continuum, and it's normal for us to respond with stress because it's the body's way of responding to a challenge, something that it has to, in one way or another, accommodate or to get over. So what we want to do is to prevent those periodic stresses that mobilize our autonomic system to kind of shift into a more chronic problem such as anxiety or depression, where we feel overwhelmed and we get to that place where we say, oh, I can't do this anymore, or this is too much. And that's really what we're wanting to give you tools for today, and give you some things that you can begin to try in order to prevent those more serious reactions from kicking in. So what's very important, the most important takeaway from today's class, is that what you do is important, right? And it's critical to maintaining wellness. And as the stakes get higher, meaning that as this pandemic continues and we remain in social isolation, it does become a little bit more and more taxing for most of us. That's what we've been hearing from our patients, is that, you know, the first week or so, it's okay. After 2 weeks and 3 weeks, it really begins to feel like you're in prison or in some way limited. And so that's where it becomes more and more important to understand there's little things that you can do, and doing some of those things on a regular basis is very important. And we're going to sort of understand a little bit about the autonomic nervous system. So on the right side of this slide, what you see is the three levels of the autonomic system, and each of these is important. They all play a role in maintaining our well-being, and so the three different, say, neural circuits within your autonomic system are governing different aspects of your day-to-day functioning. So when you are stressed, and we said the hallmark of a stress response is that your sympathetic nervous system mobilizes energy so that if it happens that there's a bear that shows up in front of you, let's say when you're on a walk outside, that sympathetic system is going to ensure that you have the energy you need to fight or flee. So you can take care of the danger, you can protect yourself, and that mobilization response, the energy that you feel, that nervous energy, is that capacity to protect yourself. So the sympathetic system does get triggered. I like to use the metaphor of a gas pedal, that if you think of the sympathetic system as a gas pedal in the car, it's there to do a very, very useful thing, which is to get you moving and get you going. And we rely on that to get us moving. And so that is very useful. However, when the stress kind of happens over and over and over again, day in and day out, and you're kind of pushing on the gas pedal over and over, it gets to a point where, for some of us, it feels like the gas pedal is getting stuck and it's just on and it's on. And we get to the end of our day and we should be slowing down to go to sleep, but we can't slow down. Our mind is still jumping around. We feel restless. It's hard to settle down and to get to sleep. And so that's where the parasympathetic system is really critical. And the parasympathetic system is sometimes called the rest and digest system. And it's more like the brakes in the car. So the parasympathetic system is what slows the body down, slows the brain down, and allows you to get to sleep at night. And of course, when you're sleeping, it also enhances your digestive system so that you're building up your reserve of energy as well as your immune system so that you're ready for the next day. So those two systems, the gas pedal and the brake, the sympathetic, parasympathetic, work the best when they are in balance, when you can kind of drive your car and press the gas pedal when you need to, but also when you need to, you can brake and stop the car, and then when you need to go again, press the gas pedal. What we want to guard against is the situation where the stresses day after day after day are keeping that sympathetic system overly activated or hyper aroused. And so one of the tools that we're going to provide for you is breathing, and using breathing techniques in a way that activates or boosts the parasympathetic system and allows you to control some of that sympathetic energy. We're not going to talk today about the social engagement system, but it is something that we need to be mindful of. And so here is what the nervous system is doing for you automatically, moment to moment, all through the day. And on the top part of the slide, there's a big circle that says your environment. Now, your environment includes both what's happening outside of the body. That means your physical environment that you're sitting in, and of course the TV and our connection with the world outside. And so some of those signals that are coming in, what we're hearing about over and over through the TV is there's a lot of stressful events going on. But the other thing that internal system is doing is it's registering how much stress there is inside the body. And among the things that it looks at or it evaluates is the tension in your muscles, as well as if you just had a heart attack or you're recovering from a heart attack or you had other medical conditions or treatments that have compromised your well-being. So that body is telling the brain that we're in trouble. And what it means is that you're more likely to start to feel anxious and nervous if you've had a medical, pure physical problem in the last year or so. It means there's more vulnerability to having a high stress reaction. And so what this diagram shows you is that in the middle, your nervous system is moment to moment deciding, am I safe? Or am I in danger? Or is the danger that I feel really feel to me like my life is on the line? And so, based on how your nervous system is making that decision for you, and this, by the way, is automatic, it's happening below our conscious awareness. So, this is not something that you're thinking about at this moment or wherever your thoughts may be. So, your thoughts may be on something positive that you might do later today. But if your nervous system is picking up signals that you're short of breath or your heart is beating very quickly, it's deciding maybe that you're getting out of safety and you're shifting into danger or actually feeling a life threat. So it's important to understand that this is happening automatically. And there is something that we can do to counteract this shift towards having this stress reaction. And that is, we're going to bring you to breathing as one kind of a task that you can do. But there are many different things that would be useful. So this slide shows you three, let's say, circles that are engaged in or provide a model or a working understanding of how we go about managing our emotions and managing our sense of well-being. And so, according to this model, there are three different elements. One is the threat system, the other is the drive system, and the third is a soothing system. And all of us have access to and can regulate each of these three domains. So threat system, its major job is to be aware of danger, right? So if you're picking up signs that there's some threat or difficulty, it's going to start sounding the alarms. So that's basically that sympathetic alarm system. Now, there is also a drive system, and that's how we can kind of regulate what we do, mainly through our left brain. So our left brain is our center for communication. It's where we understand what problems we're facing and can figure out what we want to do about those. So it's kind of the logistical brain and the part of us that is going to think about what we're facing, how we communicate with others around us, develop some strategy or goals, and so forth. And it's important in managing our stress levels. The third part of this three-part system is the soothing system. And this is where we do things that begin to slow down the underlying stress system. So this is where, for example, we can do breathing exercises, diaphragmatic breathing, which actually slows down the sympathetic arousal that we can get into if we're getting stressed out about what we're watching on TV. We're going to walk you through some examples of how you might be able to use that. And we're going to talk about whether you're already instinctively a diaphragmatic breather. That means someone who is breathing in a way that gets air into the deepest part of the lungs, the lowest part of the lungs, and it's the most relaxing for the nervous system. So we'll use that as the tool or the skill for today and walk you through how you can use that more effectively. But you could easily draw for yourself how you're feeling right now at this moment. You can draw three circles to indicate what's the size of your kind of perception of your threat system. How active is it for you? How active is your drive system? Meaning how well are you able to continue to set goals for yourself and do things across the day that are important for you to do? And how well are you able to already use strategies or techniques that calm you down. And there's many different ways of doing that. So you may already have some things that you do in that regard. But if you want to do that exercise of drawing these three circles, there is a wonderful workbook on dealing with COVID-19 that we've circulated with people. And you can do that on your own. And it gives you some more ideas about how to manage stress. So what I want to do briefly is to help you understand what kind of a breather you are. So when we're under stress, and many of our patients who have been under stress because of their health issues and other events in their lives find that they're much more of a chest breather. And chest breathing is natural when you're under a lot of stress. It really is the body's go-to state when you're in fight and flight. And so what we're guessing is that if you did these observations one by one, and I'll walk you through the first two or three just so that you can do these on your own if you're curious. But on this chart, you'll see there's a column 1, a column 2, and a column 3. So if all of your observations are kind of down the column 1, it means that you're really doing a lot of chest breathing. All of your breathing is up in the upper part of your chest, which means that right now you're under a lot of stress. And the signal that that's giving your brain is, look out, I feel I'm in danger. So we would expect a number of you to have a number of observations in that column. And if you do, that's not a bad thing. It just means that's where you are right now. These are things that you can change. And we're going to give you some ideas about how to do exercises to get your breathing to activate the diaphragmatic and the abdominal muscles in a better way. So one of the simplest things to do is to measure or count how many breaths you take in 1 minute. So what I'm going to have you all do is to sit comfortably wherever you are, and I'm going to tell you when to start counting your breaths and when to stop counting. And what you're doing is you're going to sit comfortably in your chair. You shouldn't feel any kind of discomfort or stress anywhere in your body. Just allow your body to sit as comfortably as possible. And as you're sitting there, you're going to count your breaths. And a count of 1 means the exhale and the inhale. So breathing out and in makes 1 cycle of breath. And you're going to count until I say stop, and then see what number you got to. Okay? So if you're all ready, I'm going to start the counter now. So begin counting. And stop. So just keep in mind what your number was, and it's a reflection of how much physical stress you feel at this moment in your body. If you counted, let's say 11 or 10 breaths in a minute or less, then that's a sign that you're very relaxed, you're breathing nice and slowly and nice and deeply, and that's a good thing. However, if it's above 12 to 15, it's kind of moving towards feeling much more of a chest breather. And if you counted 16 or above, it means that there's a lot of tension around the muscles that are around the lungs, and that's what you're feeling. I'm going to just do the next two, and I'm going to stand up so you can see what I'm doing. And this will give you an idea of how you're breathing or where your breath is going. It's very hard to tell where your breath is going if you just stand up and breathe. But if you put your left hand up here on your chest and your right hand on your belly, kind of around where your chin is, and your knees are going to be a little bit bent if you're standing up. And what is, you're going to take some breaths in and out, and you're just noticing if you feel any movement in your hands, okay? You should feel some movement. If there's no movement in either hand, you're in big trouble. So hopefully you feel something. Now, if the hand that's up on the chest is moving, it tends to move up and down, okay? That's what you will detect. The hand on the belly, if it moves, it tends to move in and out, okay? So there's slightly different movements. But just notice as you breathe in and out, and I'm going to ask you two questions. The first is, as you begin to breathe in, which hand is moving first? As you begin to breathe in, which hand is moving first? Okay. And the second question is, as you take a complete breath in from beginning to end, which hand is moving most? So through the whole in-breath, which hand is moving most? And the next thing that we're going to do is just notice the hand, or I'll put both of my hands on the belly so you can see what I'm doing. And I'm going to notice to see when I start to breathe in, these hands can move in one of two directions. They could either move inward towards the spine, or they could move outward away from the spine. So as you begin to breathe in, do you notice the hands are moving inward, or are they moving outward? So again, just notice which way the movement goes. And what I'm going to just kind of bring to people's attention is why are we doing these observations? It's basically to get an idea of how are we bringing air into the lungs. And you do have what's called a diaphragmatic muscle. You cannot see it because it's entirely inside the body. It's anchored to your ribs. So it's anchored here, and it's shaped like an upside down, like a parachute or an upside down salad bowl, right? Something like this. And so it's anchored to the ribs and goes up like that. And then when you use that muscle, it contracts and it's going to flatten out. And as it flattens out, it's going to bring the lungs down. So the lungs are sitting right above there. So it brings them down. And you should feel the hands on your belly moving out. Okay. So some of you may have noticed that your hands actually started to move inward. They didn't move outward, they started to move inward. And the reason for that is that that diaphragmatic muscle isn't really engaged. It's not doing anything. So you're actually breathing from up here. Your shoulders and your ribs are kind of moving up to get the air into the lungs. And so when you're breathing in from the clavicle, the shoulder area, and the ribs, you're pulling air in that way, but it's only bringing air to the upper part of the lung. So you're filling the smallest part of the lung. And as a result, you feel you're not getting enough air. And so you're going to start to breathe more quickly. And so you start to hyperventilate. This is a very common breathing pattern if someone is experiencing anxiety or panic. So it's really important to get the air down into the belly and fill the lungs, the bottom part of the lungs especially. So that's why this sort of quick assessment of where your breath is going can tell you if you're using the chest more than you should be. So the breath should be going down into the belly, and you should be filling the lungs. And ideally, you want to take a breath very slowly, nice and deeply, filling the lungs, and then exhaling. So I'm going to just, I'll be sending some links to Crystal to post, which demonstrates how you can begin to activate that diaphragmatic muscle if you happen to be a chest breather. So if you complete this assessment on your own and find you have at least 2 or 3 check marks in that first column, you want to do an exercise that activates that diaphragmatic muscle and gets you going, get the air down into the lower part of the lungs. The other thing that's important, why is breath important, especially in the context of COVID-19, is that we know that it is a respiratory virus, so it attacks the lungs or infects the lungs. And for those that get very, very sick, it tends to cause pneumonia, and then they struggle in terms of managing that risk. Another thing that I'm going to send out as a resource is a video. This is done by Patrick McEwen, I think is his name, and he works with people with respiratory illnesses, and he talks about the importance of breathlessness and how we can all do a simple test every morning when we wake up to see how breathless are we? Are we still able to kind of, are our lungs functioning normally or not? It's a very instructive video, very helpful. I found it very useful. So we'll send you the link to that or post it on the Cardiac College website. There is also the Tolerance for Uncertainty, the COVID-19 workbook, which talks about other things that you can do for self-soothing and calming the nervous system. So we encourage you to also go to that for other ideas, so that you can complement what you are learning here and how else you can do things that are helping you calm down. So just to summarize some of the things that we went over, the spectrum of stress, the importance of actively doing something to counteract that stress, and then using breathing as one tool to balance or modulate the stress system. So hopefully this has been helpful to give you an idea of what you can do. And if you go to your poll, now you can do a assessment. Was this session helpful to you? We will be answering questions that have come in. I know we started a little bit late, so we will answer questions and read those. So I think I'll start with the first question as you're continuing with the polling. So here's the question that has been sent in. After a month and a half of self-isolation, the level of stress, anxiety, and depression increased. So the meaning of social distance creates stress, anxiety, etc. So in other words, the solution is also adding to the problem. I think this is time to replace social distancing with physical distancing. People like to socialize at this time virtually. We get in touch with people that we ignored due to lack of time, but we can now socialize with them. Yeah, I couldn't agree more. And
Yeah, no,
Claire?
I definitely agree with that. There's people that I've reached out to in the last few weeks that I've thought about reaching out to before COVID, but didn't reach out to. I think it's more positive to say that we're physically distancing over socially distancing. And I think that for many people right now, the level of stress and anxiety and depression is increasing. Even just sort of trying, whereas things are becoming, I guess this is becoming our new normal. And I think a lot of people are wondering how long this is going to last. And that question is really hard for the experts to answer. And so I think people are starting to feel some pandemic fatigue at this point.
I think so too, which makes it even more important, as the question here underlines, even more important to connect with others. I think as social people or social animals, a lot of how we regulate our emotions is by talking honestly with close friends and people we care about and who care about us, and taking time for that. And we can do it now virtually through things like Skype and Zoom and what have you. That definitely we need to do that. Yeah.
And finding those people that I think are like-minded helps to make you feel more connected and understood right now. Everybody's sort of their feelings and I don't know, their understanding of what's going on is very different. And I think it's very personal to each person depending on their circumstances and even just what they're experiencing day to day and the challenges that they're dealing with, but also even what they've dealt with in the past.
Mm-hmm. Yeah. And I think the best suggestion I can give people is if you can view this somehow as an adventure. Every day is different. There's so many challenges that we don't usually have to face that we may now have to kind of struggle with. If you can keep that attitude of viewing it as an adventure, there are no right answers. You're just trying to do what you can each day. That might be a little bit of help. And I don't know if there's any other questions that have come in. Anything else that's...
I would say, Professor Stuart Jordan's University of Toronto has an excellent course on Coursera that deals with mind control. He has exposed similar thoughts as you have.
Okay, so it was a recommendation that Dr. Jordan Peterson has a website. We'll be sending you the information that we've put together so that you can access some of these links and look into these things for yourself. Thank you. And thank you if all of you have other ideas or things that you found really helpful in managing your own pandemic fatigue. Please send it to us because we will do our best to make it available to everyone so we can all learn from each other. Any other questions or comments?
Just thank you so much. I can't wait to match the patients and staff at Toronto Rehab on their very specific and extended protection measure. I know they like to be together.
Right.
Another comment.
Right. So some nice comments coming in from you. And thank you all for taking time to join us for this talk. And we will be coming back next Monday with another segment and look forward to having you join us for that. And I do encourage all of you to watch the video on breathing. It talks really beautifully about how to use breathing effectively to manage your stress and even to allow breath itself to protect you against a virus. So it's some interesting stuff that Dr. McEwen goes into. So with that, thank you again. And I think we are getting close to the end. This is, I believe, the last slide. So thank you. Enjoy the rest of your day. And we look forward to seeing you next Monday.